Patient preparation. To monitor your patient, you can either use separate ECG leads or you can use the one-step pacing or complete electrodes. ECG electrodes and multifunction electrodes must be placed on clean, dry skin. Clip away excess hair whenever possible. To monitor your patient using separate ECG leads, disconnect the one-step ECG cap and plug in a separate 3-lead cable, leaving the multifunction cable connected to the electrodes. To monitor your patient using multifunction electrodes, remove the one-step resuscitation electrodes from the side of the defibrillator by pulling from the top. Open the electrodes by grasping the cables and firmly pulling them away from the cartridge. Notice that the multifunction cable is attached to the electrodes. To apply the one-step resuscitation electrodes, grasp the rectangular red electrode labeled 1 and peel it from the plastic liner. Roll the patient onto his side and then roll the electrode onto the patient's back to the left of his spine and under the scapula. Always apply the back electrode first to prevent buckling of the front electrode. To apply the front electrode, grasp the triangular blue electrode labeled 2 from where the wire exits the electrode and peel it from the liner. Roll the electrode onto the patient's left chest, with the dark blue triangle midway between the sternum and nipple. If you are using the one-step complete electrodes with the compression sensor, place the sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples. If your patient is female, lift up the breast if necessary in order to position the electrode underneath. If anterior-posterior placement of the electrodes is not possible, rotate the apex electrode 180 degrees and use anterior-anterior placement instead. When using anterior-anterior placement, one-step pacing will not function. In this case, you will need a separate ECG cable to pace